Welcome to the podcast, Greg. I'm looking
Yeah,
forward to chatting.
me too. Thanks.
As I was saying before we hit record, I'm pretty familiar with your work just from, the anti-diet HASTE world, but I'd love to hear from you personally about your story with your relationship with food and body.
Yeah, I think that for me personally, privilege or whatever it is, I haven't really had any personal, struggles, let's say, with food or body image. But I came into this space really because I'm married to a psychologist, Alexis Connison, who does work in this field and is a psychologist. And we trained at the same place in a very weight-centric, model. And that was certainly my training and hers as well. She worked in bariatric surgery. And then we both went into private practice, and she was having experiences with clients who, were struggling with these things. And then she came across, mindful eating and intuitive eating and weight inclusive medicine. And then over the course of probably a decade, tried to convince me that this is the right approach, quote unquote, the right approach. And it finally just like clicked, and I read her book, and like it was just very research heavy, and I'm like, wow, these studies are pretty, important, and also, just changed the way I approach medicine. So that's how I came into it.
And when she was initially posing the anti-diet health at every size approach, to you, what was your initial response and what was the process like of kind of coming to the other side?
Yeah, it was so ingrained to me of how important, weight is, and that the nutrition from what I, remember from training was very much like, don't eat this, you shouldn't have too many carbs, you shouldn't have sweets, white foods are bad, all these things, which, may or may not be true, but it doesn't work for people long term. And obviously it's not, pragmatic. And, the data clearly shows that from my standpoint, like adding foods in that we know nourish us and combining foods is really important, and an elimination type nutrition is probably not good for most people, unless they have a health reason to not have certain foods. So that's kind of, where it came from. But it was hard to get over that ingrained training, and I was like, yeah, but they shouldn't eat carbs, they shouldn't eat sweets, things like that. And then just the more I read and spoke with patients and saw, the inevitability of like being on and off restrictive diets, and then seeing literature that shows that weight cycling is actually worse for people as far as morbidity and mortality than actually, staying at the same weight, and all these, big time studies, and even like the studies on BMI that showed even people, and BMI is bogus anyways, but like the research that shows people at a slightly higher BMI actually are healthier than people in like quote unquote normal BMI ranges in a lot of situations. So it took a while and a lot of reading, and certainly she's very persuasive, and eventually I kind of like clicked.
That's awesome. I think your dynamic is so cool, like such a power couple in the anti-diet world. It's pretty badass. What was there one moment that you can point to, and maybe not, but I'm just always curious, that kind of moved the needle for you? One thing you read or one thing she said?
Yeah, so I believe it was like probably like in the midst of the COVID pandemic. I was sitting on the couch at home reading her book, her draft, whatever. And I think it was probably like chapter two, like one and two are like all about research. And I don't know, one of the studies or the way she like framed something, I was like, okay, this was it. This made sense.
It's
And
awesome.
I don't know if it was just like all the stuff that was going on in the world, and I like finally had the time to like sit there and like have some space, and then it just all kind of clicked. So yeah, I don't know. I think that was probably one of the moments I think about.
And what's your experience been with other doctors, chatting about this kind of counterculture approach? Do you get a lot of skepticism? What does that look like?
Yeah, I think there's definitely no debate these days about the harms of weight stigma and weight discrimination. Even people that are very weight focused are acknowledging that, and the research is clear on that. So it's just a matter of how do we talk to patients about weight, and should that be the focus and the end all be all or not? And obviously, the way I'm practicing is, no matter what someone's weight is, weight's not the behavior. And we know, people of all shapes and sizes have health conditions and can benefit from nutrition and all the stuff that we talk about. Um, but I'm in private practice on my own office, so I don't have a lot of pushback on it. But obviously, there are doctors that, on social media or even whatever may not agree with me and, say, yeah, but wait, but still, if they lost weight, they'd be healthier and whatever, which, could be a constructive conversation.
You talk a lot about the common misconceptions with diabetes. Obviously, diabetes, there's so much weight stigma and assumptions that come with that kind of diagnosis. So I'd love to hear you kind of talk us through what are some of the most common misconceptions that you kind of see in the world and hear patients reflecting back about diabetes.
Yeah, I mean, specifically type 2 diabetes, right? Is people probably take self-blame and think that it's their fault from something that they did. And, the same from people who, perceive people who have type 2 diabetes as like their fault or something that they could have done to avoid it. And we know there's like a very strong genetic component to diabetes in general. We know that people across the size spectrum can get type 2 diabetes. We know there's so many variables that affect blood sugar. There's obviously, classic people talk about and they always point the finger about diet and exercise, but there's medications, there's, people that have pancreatic issues that end up not producing much insulin. There's, so many different variables. Those illnesses, even like post COVID, people have been diagnosed with diabetes, who may not have a family history. So there's a lot of different variables. So those are some of the things I encounter, and I think it's important to, even if it was someone's fault, there's no going back. Like let's just handle wherever we're at right now in the moment, and thankfully there's great treatments and there's ways to manage it and prevent complications. So that's kind of the approach I take.
Even if it was someone's fault, which we can never really know because some people, like, we can't keep humans in a lab and just like change one variable. But I love this kind of thought experiment of like, say someone smoked a pack of cigarettes a day for 30 years and then got lung cancer, and you were to ask like, is it their fault? Well, we still don't know because there are people who smoke a pack a day for 30 years and don't get lung cancer. And the questions are in terms of kind of blaming them, is it kind? Is it true? Is it helpful? It's not kind. We kind of will never really know if it's true because we can't, go back and reverse things and see if it would have still happened. But the third one is like, is it helpful? Being like, well, this is your fault. You did this to yourself. Like, does that change the fact that they have lung cancer or diabetes? Like, no, it just adds shame. And that always really stuck with me of like, even if it was someone's fault, like you're saying, like, how it's not a supportive way to move forward to blame them.
Yeah, I mean, I would even say like not only is it not helpful, but it's destructive to like going forward because until those thoughts are kind of discussed and whatever managed and corrected, it's very hard to move forward.
Absolutely. So the kind of pushback that I hear a lot as a dietitian with, talking to people about the intuitive eating framework is like, okay, so I have high blood sugar, like my A1C is encroaching into prediabetes territory, and you're telling me that I should eat whatever I want, that I should like, take foods off a pedestal and actually like allow them more. And I have sort of my own way of talking through that with clients, but I'm curious your thoughts on that specific kind of hesitation.
Yeah, I mean that is tricky. And I get it. So I'm not a dietitian, but I would try and encourage that person to like pair up foods and if they are going to have starch, have it with proteins and fats and things like that and come from an additive standpoint. But also like if you want to come from an intuitive eating framework from, the schematic of like diabetes or, health in general, you could say, well, how do you feel when you have those things? And if their blood sugar is kind of borderline, getting high, if they have those foods that you're suggesting are not off limits, maybe if their blood sugar is going high, maybe they're going to feel a crash, an energy. Maybe they're going to be thirsty or increase urination or any of the, or feel bloated or whatever it is. So therefore, if they're listening to their bodies, it's not off limits, but it's your body's clearly telling you something.
Yeah.
So, the A1C, the blood sugar, a pre-diabetes diagnosis or diabetes diagnosis is your body telling you this particular food is or group of food is not jiving well with your body. Doesn't mean you can't have it, but like if you're trying to promote your health, then listen to your body.
Right. Intuitive eating is about eating for the way that you want to feel and noticing that you feel thirstier or lethargic or you have a blood sugar crash is totally aligned with intuitive eating. I think about the element of like the impact of our relationship with food on blood sugar control. I'm curious your thoughts on this. I've never talked to an endocrinologist about this. If two people say who are like genetically identical clones with like all other factors alike are eating the exact same food, I always use a bagel as an example. Being from the tri-state area in my own story with disordered eating, bagels were like a big scary thing. And I think about how if in one case somebody is like eating that bagel, but their internal dialogue is like, oh my God, I'm so bad right now. This is so many carbs. I'm gonna gain so much weight. I'm being so bad. And it's like a really stressed out response
Yeah.
and how that triggers the sympathetic nervous system and leads to actually a different reaction with blood sugar control versus if you're like, this is a bagel. Like it has carbs, it has energy, it's neutral, and it's delicious and satisfying, and how that can lead to more optimal digestion and blood sugar control. This is always something that I think is like sort of underappreciated of how our relationship with food and our thoughts about the food can actually impact the physiology of what's happening with the food. What do you think about this?
I love it. I mean, I think that if anyone's listening in that's a researcher, a research study should be take that person with the bagel, have them try and think both ways and measure, cortisol, blood sugars, blood pressure, like during, after all that stuff, and see if the markers are different.
Have you seen this research study? I can send it to you after because it's kind of similar, where there was like one drink that was given to two different groups, and there's one drink but it had two different labels. One label was just like it said low sugar, and then the other drink said either high sugar or nothing at all, but it was the same exact contents, and how the one that said high sugar, like obviously the people are reading the label thinking, oh, this is high sugar, and their body's anticipating that, and it sets off a whole cascade. They actually were recorded having higher blood sugar after drinking that drink, even though it was literally the same contents in the drink. I mean, I think that's pretty much the bagel study in another format, but when we talk about okay, the person who's like, oh, you're saying I should just allow all foods even though I have an A1C that's encroaching in prediabetes territory or whatever. I think about the long game and how, like, yeah, in the short term, that might lead you to have more sweets or like less nutrient dense foods. But if that can get you to a place of feeling more peace around those foods and habituating to them, then in the long game, that's going to lead to binging on them less. And binging is even worse for your blood sugar control because you have an influx of a lot of sugar coming in at once. And so I try to like shift out of like this moment where it's scary and there's a lot of sugar coming in to like if we do this now, this will hopefully be less of a problem over time.
Yeah. I mean, I'm pretty sure, I mean, I know Alexis like encourages her clients to do this. Um, like, I don't know if she actually does, but I think maybe she said it, like fill your freezer with like a ton of ice cream or whatever. And like
Yeah.
obviously initially, like it feels off limits or like they may like binge on it or whatever, but like the longer it's there and that it's just like okay, you may have like a scoop of ice cream once in a while, but it loses its like allure in some ways because like it's not off limits, so you're not going to these like extremes. And going back to your point, it probably takes the stress and all the emotion out of it, and therefore it may not have the same physiologic impact,
Right.
as it would if like while you're eating it, all those feelings are coming up and the heart rate's up and insulin resistance is going up because that just goes with stress response in general, so
Yeah. Yeah, I love that she does that. I do that too with my clients. And I'm like, go to the store. And I'm like, what feels like a lot of ice cream? They're like 5 pints. I'm like, go to the store and buy 10. They're like, are you serious? I'm working with a dietitian who's telling me to go buy 10 pints of ice cream. But it really works. It's the habituation effect, like repeated exposure to the same stimulus makes the stimulus less stimulating. And like that's like it's
right.
just how it works. Any other common misconceptions? So we kind of covered the your health is your fault, your diagnosis is your fault. Any other common misconceptions that you encounter a lot in terms of diabetes, or speaking specifically about type 2?
Yeah, I mean, just to tease out the point a little more about, it's your fault or whatever, like the assumptions that, people with diabetes don't exercise and they're eating a specific way and they're lazy and all that stuff, is probably, more common than, it should be.
Yeah, absolutely. And when you have a patient come to you who's really entrenched in that, like, I did this to myself, this is my fault, and like really feeling the societal shame of it all, what do you find is supportive to to share with them?
Yeah, I mean, I think a lot of people just need to be like heard and listened to. And sometimes, just them saying it and then just kind of maybe saying, there's a genetic component, even if there's not, putting the self-blame game or like listening to other people like point their fingers not serving you now or in the long run. So let's just move forward and manage this and go from there.
Yeah. Yeah. A lot of what we've already covered. But yeah, I agree. Being heard is like often so much of it, especially by a
Yeah, I mean,
doctor.
I saw a patient this week who, he was saying he saw another endo and he just didn't feel heard. And I guess he had a lot of questions about supplements and things like that and was kind of like dismissed. And like whether or not I agree with some of the stuff that he was like asking about or whatever, like I think just spending a couple minutes, which is hard, like in our world of seeing 1 million patients a day. But like I think he felt heard, so he was like basically willing to travel from far away to see me, going forward because, I just listened to his questions, whether, the answer was yes or no is just, I mean, but that it's really the medical system, I don't think any doctor, endocrinologist or whatever is like trying to do harm, but like it's pretty nuts. Like if you're a patient, we have like I spend 30 minutes with a new patient, which is probably like on the generous side, for someone who takes insurance. But if you have like 15 minutes with the follow-up patient, that's why a lot of advice is like diet, exercise, blah, 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 like as the patient's like leaving, because you just don't have time.
Yeah,
You're going
totally.
through labs, you're going through all this stuff that you got to order for next time. You're constantly just under the pressure to like get through the visits.
Yeah. Yeah, and this reminds me of did you read Christy Harrison's new book? I think I see it on your shelf, the blue one, The Wellness Trap.
That's Alexis's book, I
Oh,
think.
that's Alexis. Oh, Christy Harrison's
But
is
I
the
was
one
on
next to
Christy
it.
Harrison's podcast actually for
She
like talking about the wellness.
Yeah, there's this crazy concept she has, or that she talks about in the book of, she calls it the care effect, or maybe it's like officially called the care effect, which is basically like just by like, because it's like what's going on with these functional medicine in integrative medicine doctors that like people actually feel better. And what she was able to like capture in it was that just like the fact that they're spending a lot of time and really listening and hearing is making people feel better in and of itself, aside from any interventions beyond that.
Interesting. And I also think that there's a financial, component to it also because I think if those people are seeing those doctors, out of pocket and they have the means to do it, it's almost like that also kind of, you
Totally.
know, impacts things because they have the money to like spend on these tests and the supplements and all this stuff. So it's just a different, totally different world.
That's so true. It's like people who can afford the concierge support doctors are like from a social determinants of health standpoint are probably experiencing less day-to-day stress from like just socioeconomic status.
So we were even talking about this. So I was like a big, and I haven't looked at it, but at home we were talking about it. Apparently, the blue zones whole thing was like totally debunked. I don't know if you heard that.
No.
But like I was like big into the blue zones, which for people listening, the blue zones are like all these areas of the world where people live the longest. And the thinking was always like it's, nutrition or plant-based diet, it's, family, community, having a purpose, movement, all this stuff. But apparently that was debunked because like in those areas, people didn't actually like keep accurate death records. So like it had all these people living to 100, but they actually were dead. And then part of it was like because the families were still collecting like the pensions.
Oh,
And so I guess the conclusion was like the people that live the longest in the areas that, are actually recording are the people that have wealth, because having like access and money like tends to keep you healthier or it gives
yeah.
you access to like healthy food and less stress and all those things.
Right. Wow. That's interesting. I hadn't heard that. And for people listening, I feel like anytime there's a Netflix documentary about something, suddenly the whole world is like interested, especially I used to work at Trader Joe's in Brooklyn actually, and anytime like I remember that documentary came out, I think it was called Game Changers, and the whole thesis was like be a vegan pretty much, and I literally saw it reflected in people's carts where they're buying
Yeah.
more like Beyond Meat and stuff. So yeah, there was that Netflix documentary about blue zones that came out in the last few years. I think that speaks to just like how fraught science can be sometimes. Of course, I'm not like a science denier. I'm a bachelor's of science in dietetics, but looking at this stuff critically, like the fact that it came down to the death records not being accurately recorded and like how that spawned a whole movement, which of course, like people already have it in their head now that these are the things that make you live longer. So there's that whole phenomenon where it's harder to get people to unlearn that.
I mean, they don't hurt. Let's just be clear on that. I mean,
Of
but
course.
but the fact that like, there's books and documentaries on all this stuff on these specific regions, which are like seem to be bogus at this point.
So I feel like the another sort of like elephant in the room with the type 2 diabetes conversation is this idea that losing weight will help improve your blood sugar control. And I'd love to hear you kind of walk us through why is pursuing intentional weight loss not the answer to control diabetes?
Yeah, I mean, people with uncontrolled diabetes often lose weight because they lose fat and muscle. So that's, an important point, right? So if someone's blood sugar is like through the roof and they're clearly sick because of the high sugar, because their body's basically going to this catabolic state, they're losing weight. So that's just one example, whereby like weight could be like a misperception of like someone's health, right? Someone may say on the street, "Oh, you look great. You lost, you're losing all this weight," and the person's really like in catabolic state because their sugar is really high. So I mean, look, the weight is not the behavior; it's a data point. So yes, I think if people lose weight through behaviors and diabetes, their blood sugar may become better controlled, and it may go side by side with blood sugar management. But that's not necessarily a cause and effect thing. I mean, it could be because they start exercising more, they're eating differently, all this stuff. But like I see that. I mean, I do see like as someone's weight goes down that has type 2 diabetes, their blood sugar can improve for sure. And that's because of, it could be from medication, like obviously the GLP-1s, it could be because they're exercising more and eating differently and all that stuff. But a lot of times, even if people's weight doesn't change, and we know that if their fitness improves, they're eating differently, their weight's the same, the blood sugar can still get better. So it's not a direct cause and effect, but there is certainly a correlation.
Right. Yeah, the key being correlation isn't causation. I think about with weight how there's a key difference between pursuing intentional weight loss and then unintentional weight loss happening in the background as a side effect of other behaviors of working on stress, adding foods in, increasing movement, all these things. And the research shows that intentional weight loss isn't sustainable long term, but unintentional weight loss that happens like slowly and in the background as a side effect of other behaviors is a different story. The key with like the goal being losing weight versus the goal being adding behaviors in that support your blood sugar. And if weight loss happens as an unintentional side effect, then sure, but it can also not happen and blood sugar can still improve, like you're saying, because it's not a direct causation.
Yeah, I mean, waking up in the morning saying I want to lose weight doesn't make it happen, right? It's just like it's a thought, and it's like for whoever it may be like their goal, just like the same way if you wake up and say I want better blood sugar control. It's like that doesn't make it happen. What makes it happen is like all the behaviors and things like that. So, that's why I think it's important to focus on the behaviors and medication, as needed and let the data points, fall where they lie, fall where they are.
Right. And that's why it can be so frustrating. I hear from clients all the time where a doctor told them to lose weight and they're like, yeah, like I've obviously been trying. Like, what do you think this is? Like, as if I haven't been told that a billion times. But like
Right.
you're saying, we can't just wake up, snap our fingers and like pursue that. We can actually actionably pursue increasing movement or adding foods in, but you cannot just poof, lose weight.
Right. Yeah, it's a thought, but it doesn't make anything happen. Just whatever your goals are, like, saying I want to wake up and make $1 million doesn't make whatever. Like, you got to do.
Right. Exactly. There's behaviors. So if pursuing intentional weight loss isn't the answer to controlling diabetes, and if self-blame and shame isn't the answer either, what are some evidence-based interventions to manage diabetes?
Yeah, I mean, certainly we're fortunate enough to have a lot of great medications that could do it, that can help. But, all the things that we're talking about, I try and talk about finding exercise or movement that people like and feels good because, there's obviously a negative connotation for a lot of people with exercise, that they feel like they have to go out and no pain, no gain, or like go out and run, even though they hate running or whatever. So trying to just talk about finding something that's enjoyable, if they like dancing, if they like yoga, if they like Pilates, if they, want to go throw, axes or whatever, go for it because that's all beneficial. Again, the nutrition, trying to talk about from an additive standpoint and mixing meals and if they're game for it, like using one of these continuous glucose monitors or blood sugar just to kind of see what the different behaviors, what impact they have, on blood sugar, listening to your body. Sleep is like grossly like under discussed, and probably, I mean, it's getting better, I think, but in health in general, there's just a lot of compelling evidence about the importance of getting restful sleep and screening for any sleep disorders and things like that as far as managing blood sugar. It's great to study, a lot of studies on if you sleep deprived college students who have no medical issues whatsoever, even over the course of a week of sleep deprivation, their insulin levels rise, their blood sugars go up from baseline, their testosterone goes down, cortisol goes up, and then it's a crossover study. So you let them then catch up on sleep and all of it goes back to baseline. So I
Wow.
always like talking about that for sure.
Wow.
And stress management's another huge one. I talk
Yeah.
about meditation and yoga combined with that and movement. So
And therapy.
therapy, yep.
Yeah, yeah. I feel like so many of these things don't get enough airtime. Like sleep is like it's like gets thrown in as like, oh yeah, that also impacts things, but like, oh my God, that study really captures how significant it is.
Yeah, I mean, so much is put on quote unquote diet and exercise, but and a lot of times people come in and are like, I'm eating the same, I'm like exercising the same, but my blood sugar is going up or whatever. So then I'll say, well, have you been sick recently? More stress, in life, work, family, whatever. How's
Yeah.
your sleep? And they're like, oh yeah, I had COVID a couple weeks ago, or things have been awful at work, or whatever it is. And I'm like, okay, that's it.
I have a client who I've worked with for a while who has diabetes type 2, and she was visiting her like long distance partner, and I think she was wearing a continuous glucose monitor, or even just from finger sticks and looking at the data, she was seeing how she was like, it's so weird when I go to visit him, like my blood sugar is just so much better. And she at first attributed to like, oh, well, we walk a lot, and maybe it's probably partly that. But the thing I reflected back to her is like the trips to see him are vacations for her. Like she's not working, she's out of her normal routine, which signals like it's a break. She's with the person she loves, who she doesn't get to see all the time, and all of
Yeah.
the hormones and things that brings up, and how that can help with stress management. And she's like, was kind of like, whoa, like it would happen every time she'd visit him. It was really significant for her.
Yeah. No, it's interesting. I mean, I have patients who, travel to Europe over the summer and they're like, come back and they're like, I don't get it. My blood sugar is like so good while I'm there, but I'm like eating all these pastries and I'm this and I'm that and I'm not paying attention to like my diet at all. But my blood sugar is like the best it ever is. And I'm like, number one, you're probably moving more. Number two, you're, on vacation. Number three, right or wrong, this is what I say. There's not a lot of additive, processed stuff. So like probably is like maybe quote unquote a little healthier than what we get here.
Yeah.
But all those factors play a role.
Yeah, yeah, I love those studies on like I think they call it like the French paradox of like
Yeah,
how are these
exactly.
people eating carbs and like buttery stuff, but like
Smoking
in
cigarettes
smoking
and
cigarettes, but their health is baseline better than in America. And I mean, there's so much like their, healthcare and work-life balance. And but I love the piece about like the way that they treat meals is like sacred, of like we sit down, we enjoy food, and it's not just like the American like shove a granola bar down your throat on the subway and like just
right,
keep
right.
going, like treat yourself like a machine.
Yeah, we're not doing it right, I don't think.
So the last question I have for you, Greg, is how do we make sense of the research claiming that being higher weight is associated with increased risk of diabetes? So people who are like, yeah, I hear everything in this episode, but like here's all the research I can point to that goes against everything you're saying.
Yeah, that was like something that was hard for me to wrap my head around, like in the earlier days of like having these like debates at home and wherever in my own head. And then, I did this Reagan Chastain workshop, who's she's just amazing and knows all this research cold. And the thing that really resonated with me is like most, if not all, these studies don't control for a lot of the stuff we're talking about, which is like primarily like weight stigma, access to care, socioeconomic status, all these, 40 plus variables that affect blood sugar. So, until you kind of tease all those things out, it really is just like a correlation. So, there's probably is a strong correlation, but we don't know like what necessarily the cause is. And also like going back to one of our points is like if someone ends up having diabetes, let's deal with it right now and manage it going forward. And the relationship may be there, but we don't know specifically all the other variables that are contributing. And it's, as you said, it's not helpful to like point fingers and like look at those things. It's helpful to like try and move forward.
Yeah. Yeah, and I think about like even if the research was like being higher weight leads to diabetes, and this is a for sure causation, not correlation, which it isn't. Even then, it's like, okay, well, we don't have a safe and sustainable way for achieving long-term weight loss. So if we try to work with people on intentional weight loss and that results in weight cycling, that's even worse for your blood sugar. So even if that was what we found, we would still kind of be like what in this dead end of a place of like, well, there's no long-term way to safely achieve weight loss, intentional weight loss.
Right. And it'd be hard to predict even, in that model if we did come from that standpoint of like who is going to develop diabetes, like based on body habitus. A lot of people in larger bodies never go on to develop any metabolic conditions whatsoever because, they're living quote unquote healthy lifestyles and exercising all the stuff we're talking about. So like putting an intervention in for like the possibility that they may develop diabetes because of their weight, is another whole conversation.
Yeah. This is a whole can of worms, but I feel like the conversation wouldn't be complete if we don't just like, if I don't just give you the chance to say something about it. Is there anything that you would want someone listening to this who is either navigating, a climbing A1C or like currently has type 2? Is there anything you'd want them to know about GLP-1s?
Yeah, I mean, for 12 plus years, maybe more, 14 years at this point, I've been prescribing GLP-1 medications to help people manage diabetes, and they're very, very effective. And no one was really talking about, the complications and like their effect on weight until really like probably 5 years ago. And yeah, when I was prescribing them like in clinic and fellowship, we talked about it, which was 12 years ago or more at this point. We talked about them the same way we talked about any side effect of any medication. It wasn't like a big deal. It was like, just you may get nauseous or whatever it was. And it was just like the same way we talk about any medication and potential side effects. So they're very effective. Have very, very good success using them for diabetes. I think, the data obviously on weight showing that if people go on them and then stop them, people are gaining back, two-thirds of the weight that they lost or maybe more. And we know, as we discussed, the impact of weight cycling, so that has to be part of the conversation is like if someone's prescribing these or someone wants to take these, this is really being prescribed or it should be prescribed as a chronic medication for some kind of metabolic reason. It's not something to take just because, some summer, thing or you want to lose a couple pounds or whatever, because there's side effects and it's dangerous to go on and off the medications potentially. So that's where I would leave it.
Yeah. Yeah. What I hear you say so much in that is like, this is a really different conversation for someone with a metabolic disorder like diabetes versus the person who just wants to lose weight for the pure sake of losing weight.
Yeah, so like 10 years ago, like it was an easier conversation because it was like, okay, you have diabetes or you have insulin resistance, or I mean, obviously a lot of compelling evidence coming out about what these medications could be good for. It was like, you have this condition, I think this medication would be helpful for you. Let's prescribe it. Now it's like there's a lot of other variables because people are coming in because of all the cultural stuff and because of such the focus on weight, it kind of detracts from like how effective for whoever the right patient could be, distracts from the conversation and makes it a little more complicated.
Yeah, I can only imagine how much you're seeing it in your world. I mean, it's everywhere.
Actually, I think it's becoming more, but it's also becoming less. I don't know if that makes sense. Like I feel like a year ago it was like every patient was asking for it, and now it's kind of like not as much, but I don't know. That could just
Yeah.
be anecdotal.
Huh. Yeah, I mean, like so many things, they lose steam. Like we're like as a cultural, like super fixated, and then it's like on to the next thing, whatever the
Right,
next thing is.
right. It seemed, yeah, I don't know.
That's
It's fizzled
interesting.
out a little bit, which like is good because hopefully the people that in my clinical, judgment that should be taking the medication and certainly other endocrinologists, whoever, it makes more sense than just someone saying like, oh, so and so is on it, I want to take this medication.
Totally. Yeah. My gosh, it's so rampant in some like mom groups that I
Oh yeah,
know.
sure.
Like one of
Yeah,
them's on and they're like, "Ooh, she looks good." And like
right,
they all want to
right,
get it's like candy. It's insane.
right. Yeah.
There's two questions I ask everyone who comes on the show. The first is, what is your biggest diet culture pet peeve? And for you, more specifically, like maybe diet culture pet peeve as it relates to diabetes.
Yeah. I mean, I think that, that foods are kind of off limits and like the whole like restrictive, like that you can't eat carbs, I think is a big one, because like I think the data pretty much shows like a ketotic, carb-free diet is not sustainable, number one, and then, raises things like cholesterol and all these things because obviously you replace it with more saturated fats and things like that. Um, so, I think that's something. So I try and really talk about, as we've said, incorporating more foods and pairing up foods and really just like listening to the body rather than like external, sources, in the media or whatever telling you that this diet is one size fits all and everyone should be on X diet.
Yeah. Yeah. As you were saying that, I was thinking about too how like doing the deeper work on, of course, I'm so biased as an intuitive eating dietitian, but like on healing your relationship with food and your body image and your relationship to your body is like such an upstream approach to helping these things that like it's not like don't eat carbs, but it's like again the longer game and like the deeper game and a little bit more like complex in terms of like it's not a meal plan, but um I mean I've seen it personally be so supportive for folks if they're willing to do that deeper work, really like unpacking their history and diet culture and unlearning all of the shame and associated rules with food.
Yeah, totally. No, I mean, it's a lot, obviously, and people come into the doctor and they have a limited amount of time and doctors have limited training in nutrition and eating disorders and all this stuff and it just kind of you're supposed to talk about these things and you have not much time to do so you just throw out whatever the blanket advice is and that's it and
Right.
not necessarily knowing or if you don't ask you don't know someone's history with dieting and body image and all this stuff and that person unfortunately goes home and cries or gets
Right.
totally derailed in whatever the recovery is because you didn't ask or you didn't have the training of how to give advice or recommendations and that's it's not your fault it's just training in the medical system and whatever but
Yeah.
hopefully we can educate more around that.
Absolutely. You're doing such awesome work. Even just like, yeah, that exactly what you just said is the exact thing that I hear clients reflecting to me of like what is frustrating about encounters with doctors. And especially there's this added layer of like doctors as they should like with all the education and training you have hold like such power. It's like whoa, the doctor said this and it's like whoa, like it like hits different from the doctor if they say something, if they give a piece of advice and it feels like oh no, but the doctor told me to lose weight, like the doctor told me I shouldn't eat this, and it's like it's a doctor. And how that can really instill like an added fear and shame because of that, I guess, power differential. I don't know what your thoughts are on that.
Yeah, I mean, I think that power's probably like gone down a little bit just like because of like what our culture is, which is probably a good thing. It's more of like I don't know, like a service business in some ways now. But like, obviously the power dynamic exists, but I think it's different than it was maybe like, 10, 15 years ago, the classic like patriarchal doctor now, like there's reviews and there's like people can go to other doctors and so there's like maybe a little less of that, but I agree, certainly like I hear it all the time from patients
Mhm.
who, had unfortunately had bad experiences. So I know it's a thing.
The other question I like to ask everyone who comes on the show, we talk about, the opposite of dieting and restriction is intuitive eating, which you're obviously deeply familiar with, and also the work your wife does. And I really got interested in asking people, what does intuition mean to you, and how do you personally experience it
With regard to eating or in general
in life?
in life. Yeah, I mean, just trying to hone in on what I mean, what my body needs, what I need in my life, when I need rest, when I need food, when I'm stressed, just and trying not to, and then I don't know if this is intuition or not, but like if I'm having a certain emotion, not trying to suppress the emotion or like say it's bad, but just trying to come at it with curiosity.
Mm, yeah.
Whatever's going on. I mean, easy to say, hard to do, but like just taking a curious look into like whatever my body or my being is telling me.
That's beautiful.
Yeah, I mean, I think anxiety is a good example. If like I'm feeling anxious, it doesn't do me any good to like, continue that spiral, but rather to like approach it from like a curiosity standpoint and say like what's making me anxious right now and all that, and just having that inner thought and like discussion like dismantles anxiety because you're coming at it from curiosity rather than like trying to repress it or label it as bad.
Yeah, yeah, absolutely. Is there anything that you want to add, you want to share to make this conversation complete?
I think we did. I think we nailed it. We did it.
We nailed
Yeah.
it.
And that's
Where can people find you or learn more about your work to stay connected?
So I'm on Instagram mostly is like my main social media, everything underscore endocrine. And then my office practice is Central Park Endocrinology. So the website's centralparkendocrinology.com. We see patients in New York is our main thing. So for televisits or in person.
Awesome. Thanks so much, Greg. I loved
All
getting to
right.
have this conversation.
Me too. Thank you so much.